What are coronaviruses? SARS-CoV-2 has a place with a group of single abandoned infections known as coronaviridae, a typical kind of infection which influences well-evolved creatures, flying creatures and reptiles. In people, it ordinarily causes mellocontaminations, like the normal cold, and records for 10–30% of upper respiratory tract diseases in adults. 4. Increasingly genuine contaminations are uncommon, despite the fact that coronaviruses can cause enteric and neurological disease. 5. The hatching time of a coronavirus fluctuates yet is commonly up to 2 weeks. 6. Past coronavirus episodes incorporate Middle East respiratory disorder (MERS), first revealed in Saudi Arabia in September 2012, and extreme intense respiratory condition (SARS), recognized in southern China in 2003. 7. 8. MERS contaminated around 2,500 individuals and prompted in excess of 850 passings, while SARS tainted in excess of 8,000 individuals and came about in almost 800 deaths. 9. 10. The case casualty rates for these conditions were 35% and 10%, individually. SARS-CoV-2 is another strain of coronavirus that has not been recently distinguished in people. In spite of the fact that the hatching time of this strain is right now obscure, the United States Centers for Disease Control and Prevention demonstrate that manifestations may show up in as not many as 2 days or up to 14 days after exposure. 6. Chinese specialists have demonstrated that SARS-CoV-2 might be irresistible during its brooding period. 11. Where has the new coronavirus originated from? It is as if now hazy where the infection has originated from. Initially, the infection was comprehended to have started in a food advertised in Wuhan and therefore spread from creature to human. Some exploration has guaranteed that the cross-species transmission might be among snake and human. Notwithstanding, this case has been contested. 12. 13. Well-evolved creatures, for example, camels and bats, have been ensnared in past coronavirus episodes, yet it isn't yet clear the specific creature cause, assuming any, of SARS-CoV-2. 14. How infectious is COVID-19? Expanding quantities of affirmed analyze, remembering for social insurance experts, has demonstrated that individual-to-individual spread of SARS-CoV-2 is occurring. 15. The prime proliferation number, for example the normal number of cases a solitary case produces through the span of its irresistible period, is right now evaluated to be between 1.4 to 2.5, implying that each tainted individual could contaminate somewhere in the range of 1.4 and 2.5 people. 16. Essentially to other regular respiratory tract contaminations, MERS and SARS are spread by respiratory beads delivered by a tainted individual when they sniffle or cough. 17. Measures to make preparations for the disease work under the flow suspicion that SARS-CoV-2 is spread in a similar way. How is COVID-19 analyzed? As this coronavirus influences the respiratory tract, basic introducing indications incorporate fever and dry hack, with certain patients giving respiratory side effects, for example sore throat, nasal blockage, disquietude, cerebral pain and myalgia, or in any event, battling for breath. In serious cases, the coronavirus can cause pneumonia, extreme intense respiratory condition, kidney disappointment and death. 18. The case definition for COVID-19 depends on side effects paying little heed to travel history or contact with affirmed cases. Determination is suspected in patients expecting admission to medical clinic with signs and manifestations of pneumonia, intense respiratory trouble disorder or flu, and in those with another consistent hack or fever who are all right to remain in the network. See box 1. Another side effect, a misfortune or changed feeling of typical smell or taste, anosmia, was included the 18th of May 2020. An indicative test has been created, and nations are isolating suspected cases. 19. Box 1. Who qualifies as a suspected COVID-19 case? Patients who meet the accompanying standards. Inpatient definition. those expecting admission to clinic, and the individuals who have either clinical or radiological proof of pneumonia or intense respiratory misery disorder or flu-like disease, fever 37.8 degrees Celsius, and at any rate one of the accompanying respiratory side effects, which must be of intense beginning. Tenacious hack, with or without sputum, dryness, nasal release or clog, windedness, sore throat, wheezing, sniffling, or lost or change in ordinary feeling of taste or smell, anosmia, indetachment or mixed with some other side effects. Clinicians ought to consider testing in patients with new respiratory indications or fever without another reason or intensifying of a previous respiratory condition. Patients who meet the accompanying standards and are all around okay to stay in the network. New persistent hack or high temperature or anosmia, a misfortune or changed feeling of ordinary smell or taste. People with a hack, fever or anosmia who live alone should now remain at home for 7 days from the beginning of side effects. Family units should all self-segregate for 14 days on the off chance that one part shows manifestations. Clinicians ought to be aware of the chance of atypical introductions in patients who are immunocompromised. Elective clinical determinations and epidemiological hazard elements ought to be thought of. Source: Department of Health and Social Care. What social separating measures are being taken in the UK? The legislature propelled its coronavirus activity plan on 3 March 2020, which subtleties 4 phases contain, delay, relieve, research. 20. On the 12th of March 2020, the UK moved to the defer period of the arrangement and raised the hazard level to high. On the 16th of March 2020, Johnson said that the UK is now moving toward the quick development part of the upward bend and, without exceptional activity, cases could twofold every 5 or 6 days. He reported social removing measures, for example, telecommuting and maintaining a strategic distance from get-togethers, just as family disengagement for those with symptoms. 21, 22. Further social separating measures were declared on the 18th of March 2020, remembering shutting all schools for the UK with the exception of helpless youngsters and those of key labourers, for example, drug specialists and other well-being and social consideration staff, educators and conveyance drivers. Eateries, bistros, bars, relaxation focuses, clubs, films, theaters, historical centers and different organizations were additionally advised to close. On the 22nd of March 2020, Johnson reported that the most clinically amazingly defenseless individuals, including the individuals who have gotten organ transplants, are living with serious respiratory conditions or explicit malignant growths, and a few people taking immunosuppressants should remain in their homes for at any rate the following 12 weeks. See Box 2. Be that as it may, the administration refreshed its recommendation on the 31st of May 2020, uncovering that the individuals who have been protecting can go outside with individuals from their own family unit from the 1st of June 2020. The individuals who live alone can meet outside with one other individual from another family unit. Further unwinding of the administration's recommendation was reported on the 22nd of June 2020, to become effective on the 6th of July 2020 and the 1st of August 2020. Box 2, Shielding from COVID-19. Those classed as clinically very helpless may incorporate the accompanying malady seriousness, history or treatment levels will likewise influence who is in this gathering. Strong organ transplant beneficiaries. Individuals with explicit malignant growths. Individuals with malignant growth who are experiencing dynamic chemotherapy. Individuals with lung malignant growth who are experiencing radical radiotherapy. Individuals with malignant growths of the blood or bone marrow, for example, leukemia, lymphoma or myeloma who are at any phase of treatment. Individuals having immunotherapy or other proceeding with counteracting agent medicines for malignant growth. Individuals having other focused on malignant growth medicines, which can influence the insusceptible framework, for example, protein kinase inhibitors or PARP inhibitors. Individuals who have had bone marrow or foundational microorganism transplants over the most recent half year, or who are as yet taking immunosuppression drugs. Individuals with serious respiratory conditions including all cystic fibrosis, extreme asthma and serious constant obstructive pneumonic. Individuals with uncommon illnesses that fundamentally increment the danger of diseases, for example, extreme consolidated immunodeficiency, homozygous sickle cell. Individuals on immunosuppression treatments adequate to altogether build danger of contamination. Ladies who are pregnant with critical coronary illness, inborn or gained. An exacting lockdown began in the UK on the 23rd of March 2020, with individuals advised to remain at home but to purchase basic food and medications, one type of activity daily, any clinical need, and venturing out to and from fundamental work. Get-togethers of multiple individuals in broad daylight was not permitted in all shops selling superfluous merchandise, libraries, play areas, outside rec centers and places of love shut. Every single get-together, including weddings, absolutions and different functions, however barring burial services, were dropped. An unwinding of the lockdown was declared by Johnson on the 10th of May 2020. The government distributed a 60-page recuperation technique on the 11th of May 2020, which sets out the following periods of the UK's reaction to the infection, including facilitating some social limitations, getting individuals back to work and reviving schools. What's going on with testing for COVID-19? Starting at the 12th of July 2020, 11,990,257 antigen or counteracting agent tests for COVID-19 had been prepared or conveyed in the UK. On the 2nd of April 2020, Wellbeing Secretary Matt Hancock sketched out designs to significantly expand testing over the UK to 100,000 tests every day before the month's over. An objective that was at first met. The new objective is 200,000 tests per day before the finish of May 2020, which was surpassed on the 30th of May 2020. Tests would now be able to be gotten to by anybody with side effects in England and Scotland, and anybody beyond 5 years old with side effects in Wales and Northern Ireland. Tests can be reserved by means of nhs.uk coronavirus. A NHS test and follow administration was propelled across England on the 28th of May 2020, with comparable administrations beginning in Scotland and Wales around a similar time. Any individual who tests positive for the infection is reached to share data about their ongoing associations. Individuals recognized as being in close contact with somebody who tests positive should self-separate for multi-day